All right, we're going to go ahead and get started. Welcome everyone to another live stream. My name is Nick Zupan. I'm an epidemiologist with the Rock County Public Health Department. And thank you for joining us today for another live stream event. We're going to be talking a little bit about the case activity today and potentially what the models are saying for future directions and trends and things like that. So as we move forward with the content, if you do have questions, feel free to put those into the comment section below the video, and we'll try to answer questions as they come up. Otherwise, we'll just get into it. If you're watching the recording, you can always send us comments and questions after the fact. So what I have here displayed is the number of cases on a daily basis, and this is a graph that we report on a daily basis every weekday. But basically, this displays the number of new cases that are coming into our system every single day. And then the black line here represents the moving average. So we take an average of the last 7 days and we display that along with the trends in the case activity to try to get a sense of what direction the trends are moving. And so one of the things that happened in early January was there were so many cases coming into our system, and we use a statewide system called the Wisconsin Electronic Disease Surveillance System. This system was experiencing a backlog in processing those positive results. About within 1 week into January, the state had implemented a fix for that system, and that cleared out the backlog. And so what we saw was pretty high levels of cases being reported to the health department in those first couple of weeks in January. And they may have been elevated in terms of when those individuals tested positive. So that backlog included maybe about a week's worth of data that had yet to be added to our official tally for case counts. So all that means is that the first couple of weeks in January may have been artificially inflated due to this backlog and the case activity. And you can kind of see that in this black line here. We see leading up to kind of the winter holidays and the New Year's, that black line continues to climb. I'm just putting my mouse above here because as I mouse over these red bars, it shows me the individual data points on a daily basis. But basically you can see that black trend line is bouncing around a little bit, but basically moving in an upward direction until we get to about January 1st, and it drops pretty significantly, and then it shoots right back up. And so what I'm thinking is what happened is this backlog kind of created some inconsistencies in the day-to-day reporting, and also threw off some of the weekly moving averages in our data. Essentially, that has been fixed at this point, and so we're now seeing more consistent levels of daily reporting of COVID-19 cases. So as soon as someone tests positive and the laboratory confirms that this person does have COVID-19, we're getting that record in as real time as possible. So making the system a little bit more efficient in terms of real-time reporting of case information and trying to provide that in an up-to-date fashion on our public reporting and the data that we make available on our website. So what you can see in the last week or so, we're starting to see actually a decrease in the 7-day moving average in the number of confirmed cases. And I see this as a good sign. You know, we're not out of the woods yet in terms of the pandemic or seeing high levels of case activity. We're still averaging about 250 Rock County residents testing positive for COVID-19 on a daily basis. So these are, you know, we're still seeing higher levels than we had seen previously in the pandemic, but the trends are moving in the right direction. And I'm hoping that this is a positive sign. Elsewhere in the United States, they've started to see a decrease after the surge in Omicron cases. I'm hoping that Rock County is going to be following that trend here in the next few weeks. Time will really tell, and it's really important that we continue to practice those prevention measures in our community, and including mask wearing and getting a vaccine to protect yourself against severe illness from COVID-19. So if you haven't gotten vaccinated yet, or you're looking to get a booster shot or a second dose in that 2-dose series, you can always go to rockcountyshot.com or visit the Public Health Department website for more information on where vaccines are available in our community. But basically, we are starting to see a downward trend in our daily averages of new cases. So like I said, we're averaging just under 250 new cases per day over the last week, and this is data from yesterday. So I see that as a positive trend, and wanted to give you a sense of some of the models that are projecting the COVID trajectory here in the next few weeks, and what the kind of the national models are saying, and some of the experts out there who do kind of communicable disease modeling for a living, and they have some pretty sophisticated models. So I'm going to switch gears a little bit here, and I'm just pulling up. This is from the website COVID-19 Scenario Modeling Hub, and you can find this. There's the URL at the top of the page. You can also Google COVID Modeling Hub, and this will be your first result that comes up. But basically, this website takes models from around the United States and around the globe and tries to combine them into what they call an ensemble model of COVID-19 spread. So the idea is, one model may not be as good at predicting 3 weeks into the future, and some other models may be better at predicting beyond that 3-week mark. And so the idea with using an ensemble is kind of putting all the models together and finding an average of all of these models to figure out kind of where we're headed and where we've come. So what I've put together here for the live stream is just looking at one scenario. So basically, we're looking at the Omicron spread, where potentially people who have been previously vaccinated or have previously had COVID-19 are a little bit more susceptible to infection, but the severity is lower. So we're seeing right now, we do have relatively high levels of hospitalization still across the state, although those numbers are decreasing. By and large, over the kind of the proportion of total numbers of cases, we're seeing a lower percentage of the total cases result in severe illness. So I put that into the model in terms of that's what we want to look at is a situation with Omicron spread where there's potentially lower risk of severe illness for the general public, but there is higher levels of cases among people who are fully vaccinated or who have had COVID in the past. So the graph on the screen here is showing the number of weekly cases in Wisconsin, and the solid gray line here, this is the actual data that we have. And then the kind of the gray shading with the black line running through it, that's what the model is projecting. So right now you can see that the model is a little bit off in terms of under projecting the total number of cases in Wisconsin, but it is giving us a sense of our direction. And I think that's kind of the important part of this model. So in terms of the data that they have in this model, it always lags a little bit. So the most recent weekly counts they have are through the 22nd of January. So we're seeing that the model is kind of under projecting right now the total case activity in Wisconsin. But right now, also, the model is projecting a decrease in case activity. And I do see this as a positive sign where in Wisconsin, we may be close to kind of the peak of this most recent wave of COVID activity and could see a pretty strong decline in the number of cases and new cases that are being reported across the state. So I'm hopeful that that trend is going to be followed and across the state, including Rock County. And so really time will tell, and these models are simply models that have some assumptions built into them, but try to use the data that we have and pretty sophisticated statistical processes to try to project where we'll be in the future. So I can't say for certain that we will start to see a prolonged decrease in COVID activity, but the models are showing that the outlook is at least positive in terms of the direction that we're moving. And this particular model shows that by mid-March, we could be in a situation where we're seeing very, very low COVID activity across the state of Wisconsin. The model also provides us with the ability to look at how many hospitalizations there may be. And again, this is Wisconsin, but trying to think about Wisconsin and how that may correlate to the trends in Rock County. When we look at the number of new hospitalizations due to COVID-19, the models are a little bit more accurate, I would say, in terms of aligning with the current trends. So the week ending in the 15th of January had over 2,600 hospitalizations across the state of Wisconsin. And then the next week, there were 2,300, a little bit over 2,300 hospitalizations. So starting to see a decrease in the number of hospitalized cases. We have seen a slight decrease in hospitalized cases in Rock County. We're not to levels where we'd like to be in terms of having very, very few people in the hospital getting care for COVID-19. We're still in kind of the range of the mid 50s in terms of a daily number of patients in the hospital getting care for COVID-19. So we're not there yet, but the signs are positive in terms of the trends that we're seeing and some of these statewide models. So again, this model is showing that by kind of the end of February and early March, we could see levels of severe cases of COVID-19 being back down to where they were last summer, which was very, very low. And that was the kind of ideal situation where we saw very little case activity and very little people, very few people in the hospital getting care for COVID-19, very few severe cases of COVID-19. So I wanted to offer that as kind of an indication of where we may be heading in the next few weeks here. I mean, these models are based on what we know now. There could be changes in the future that could result in modifications to these models if there's additional subvariants that circulate, or there are additional pieces of information that we learn about the Omicron variant that is circulating. So just wanted to provide that piece of information for the stream today. We do have a projections document on our Rock County website. So co.rock.wi.us/public health is our Rock County website. And you'll see a COVID-19 graphic at the top of that page, and you can access a number of our data reports, including this projections document. So what I wanted to display for today is just the most recent update that we've had to our 4-week estimated projections and kind of how we're trending. Essentially, we use a similar effort in terms of using some statistical analysis and some modeling tools that we have access to try to use the trends that we've seen in the last few weeks to try to predict and project the number of cases moving forward. And so instead of new cases, what I try to do is project the number of total cases that we'll see in the future, just based on recent trends and how the virus is spreading locally. So what you can see is as you mouse over this graph, you'll start to see the day-to-day kind of estimate for where we may be in terms of our COVID-19 spread. So I'm just pulling up the January 28th data. The model right now is estimating that there will be over 34,400 cases today, and there are lower case numbers than that projection. So I'm happy to kind of say that our model is overestimating the number of cases that there will be, and that is basically a good indicator that the rate of transmission is slowing down in Rock County. If it were consistent with where we were a couple weeks ago, we would probably see more cases than what the model was projecting. But basically, the model is at this point overestimating COVID spread because it's using the levels of transmission that were occurring a week or two ago as kind of its basis for formulating these projections. Essentially, what that means is that we are seeing a slowdown in case activity, which is the ideal situation. We're, like I said, we're not out of the woods yet, where we still have about 250 new cases per day, but the trends are moving in the right direction. Again, the best way we can get out of this wave is to have everyone get vaccinated if they are eligible for a vaccine, and get your booster shots if you're eligible for a booster shot. So people who are eligible for a booster shot are those who have completed either the Pfizer or Moderna 2-dose vaccination series at least 5 months ago, and those who have gotten that Johnson & Johnson 1-dose series at least 2 months ago. And if you have questions about this, you can always contact your healthcare provider, your regular doctor. They'll be able to help you figure out whether or not you're eligible for a booster dose, but the booster dose still shows high efficacy against the Omicron variant and preventing severe illness and hospitalization. So those are kind of the key tools, and as well wearing your masks and upgrading your mask to one of those N95 or KN95 masks is going to be your best protection moving forward here. And hopefully in the next few weeks, we'll start to see a pretty significant downturn in case activity. But again, time will tell. There's always the possibility that there could be some unforeseen circumstances that arise. But if things continue as they are and we continue to wear our masks and get vaccinated and practice those social distancing and other kind of hand hygiene practices as we have been throughout the course of this pandemic, we're going to come out on the other side, and hopefully we'll be in a pretty good position moving forward to move out of the pandemic phase of COVID-19. But you know, that's we'll know more in a few months here what the outlook looks like for that. So with that, I'm just going to check the chat box and see if there have been any questions. So let's see. So I have a couple questions in the chat here, so I'm just going to read through these. Is there any way to go back and make the graph to reflect when the test was taken rather when the test was reported? So that's a great question. And we have kind of been talking about that because when people are testing is when it's closer to when they are kind of actively confirmed with COVID-19, they have active disease and are able to spread it. We do have that information in our municipalities report. So I'll just pull that up and display that for people to see. So again, the website, co.rock.wi/public health, the URL here at the top of the page. And we go to our data link and we scroll down here. So we remain consistent in terms of our daily reporting of numbers with the state for the county on the whole, because the most real-time data we have is basically the measure of the number of new cases that are reported to the health department. If we went by when people are being tested for COVID-19, we would see kind of up to a 2-week lag in having up-to-date information on case activity. We don't always get information on that lab report when the person tested for COVID-19 or the date of the test. And so that would require follow-up on our end to try to determine that. So just as an example, in this municipalities report, we have information for each of the kind of the main municipalities in Rock County, including the number of new cases. And these graphs actually do show when the individual is tested rather than when the positive case was reported to the health department. So this is slightly different, but kind of getting to that piece of data that people are interested in seeing. And you can see that there is a gray box here over the last about 2 weeks of data, because we do see that as time goes on, our case records are updated, and we work to make sure our case records are complete and include that information. You can also see that about 217 of these records do not include a date when the individual is tested. So potentially we're losing a little bit of data in terms of our confirmed results about when people are testing positive. And it's not an ideal situation. I would love to have complete records and perfect data so that we could report in real time how many people on a specific day are testing positive, and we could report that on that exact day. But we're kind of at the mercy of the data systems that we have available to us and how we can report that information. So if you're interested in that information, I encourage you to go to the municipalities report to see how those trends are moving. They do tend to, because there is a lag in getting the information about when people tested positive, I think there always is going to be this little tail at the graph, whether or not it's truly reflective of the current situation and COVID trends, that it will look like there is a slight decrease in case activity within the last week or two. And so that's kind of one of the challenges that we run into when we don't have 100% complete records in terms of when people tested positive. All right. Looking to see if there are other questions. Looks like there's another question about how we're doing in terms of the wastewater surveillance. So bear with me, I'm going to open up another link, and I have all these bookmarks, so they're easy for me to find. But if you again, you can see the URL at the top of the page, but if you Google COVID-19 DHS in Wisconsin, you can see this information come up as well, and it'll be the first link there. And on the sidebar, they have their wastewater monitoring section. And a couple of weeks ago, we did do a panel, a little discussion on the wastewater surveillance that's going on in Rock County. So I invite you to check out that recording to get a little bit more information. I'm going to go quickly through this this text to get to the actual data. And so on this page, we have our map of Wisconsin and the different municipalities that are conducting the wastewater surveillance. I'm just going to click on the Janesville Water Utility. And the wastewater trends are moving in the right direction. You can see, so just to back up a little bit here, the graph here in the top right corner of the dashboard, that's an indication of the wastewater monitoring of how much concentration of COVID-19 is in the wastewater over time. And then the graph at the bottom is the 7-day average case rate of COVID-19 in Janesville within that watershed utility. So, or sewer shed, sorry. So basically what we're seeing is the trends in the wastewater are moving in the right direction. We're seeing most recently that there's a little bit of a drop off in terms of the levels of COVID in the wastewater, which is another good indication that we could be moving into kind of a period of recession in terms of COVID activity locally. This again is just a sample, a snapshot of Rock County on the whole. This is only including wastewater that is collected from the kind of the Janesville area and people who are connected to the sewer system in Janesville. So it's one piece of information that I think helps indicate the direction of the case activity in the pandemic. Still pretty high, like I said, we're still seeing high case levels, but the trends are moving in the right direction. Okay, and it looks like we did post the link to the wastewater site. So looks like we have no other questions today. Let me just make sure I'm not missing anything. No other questions. So again, thank you for tuning in today. If you have questions for us or want to hear about a topic for a future live stream, feel free to reach out to us via social media, and we'll try to include questions or topics in future live streams. We always like to hear what people are interested in learning about, and hopefully we'll get some more special guests on these live streams to make it a little bit more exciting for the viewers. So with that, I'm going to close out. Thanks, everyone. Stay safe and healthy, and we'll see you in a couple weeks.